When it comes to blood work, there are a couple of differences that you need to keep in mind. One is conventional ranges, which typically happens if you go to an allopathic physician and perhaps you're having a physical or there's something going on, they need to take a look at your blood work. There is, however, a deeper dive into blood chemistry panels, which is the functional ranges for all of the different markers that you're looking at. It turns out there's actually another part of blood work that needs to be looked at that's often overlooked, and that is how the body changes during the conception cycle, starting all the way from preconception through postpartum. And today I am absolutely delighted to introduce two very dear friends and colleagues. They are both wellness professionals, Sara Russell, Marianne Marks. Sara owns Build, Nurture, Restore. She mentors clinicians and nutritionally supports clients who have complex reproductive issues. Marianne is the founder and CEO of a company called Lab Smarts, which does bio-individual blood work analysis software. And these two brilliant ladies have teamed up together for a project they're calling Why You Never Learned About Blood Work in Preconception, Pregnancy, and Postpartum, after both discovering that there were major gaps in some of the widely used functional blood chemistry ranges for this part of the life cycle. Ladies, thank you both so much for being here.
Oh, thank you, Mira.
Thank you so much for having us. It's such a pleasure being here with you, Mira.
Absolutely. And I would love to start with talking about why traditional functional ranges perhaps are not the best markers to use anywhere along that conception cycle.
Yeah, I could take that one, Sara.
Yeah.
That's my specialty here with Lab Smarts and the software. And so when you get on the lab reports for LabCorp Quest, there are those reference ranges on those lab reports. So those typically just represent 95% of the population tested, either at that lab across the country. There's regional places, hospitals that have different ranges. Everybody has these different ranges, but they only are basing those ranges off of the population that are tested. So who goes to get their blood tested? People who go to the doctor that aren't feeling well. So we're using a reference range built on data from a population of unhealthy people for the most part. And you could see over time, years and years, these ranges keep getting wider. So if you really don't want to be, so that's the lab range, that conventional range, like Mira said, that's 2 standard deviations from the mean, from the middle. Okay. So the values that fall in the upper and lower ends of those ranges really don't represent optimal health, don't represent health at all, really good health at all. And the reason how they can't, sometimes you hear, oh, the normal range really, that just comes from the statistics, the Gaussian curve, where they just take a normal distribution. So that's really all that means. It's not normal. It doesn't mean you're normal, you're healthy. It just means it's a normal distribution. So in our alternative, functional, integrative world, holistic, I hate calling it alternative. In the world that we're in, where we care a little bit more to try to figure out the root cause of things, we have these ranges. We call them optimal or functional ranges. There are a tighter set of reference ranges. Maybe they may start out way back when we started out with just 1 standard deviation from the mean. So the lab ranges are 2 standard deviations. A tighter range would be 1 standard deviation. Then what I do in my software is I've spent thousands of hours looking at studies to back up these optimal reference ranges, where they may be mortality studies. Say if you have this marker over this level, you have a higher risk of mortality or cancer or something. So these ranges are backed up by different studies that show, and all of them show that they should be a lot tighter and around the middle than those ranges on the lab report. And so we take it one more step further, and in what I call my software bio-individual blood work analysis, where we also use reference ranges that are specific to that patient, that client, that are because blood changes in everyone, and men have different blood than women. Younger men have different blood than older men. The different phases of the menstrual cycle, the blood looks different, especially estrogens and sex hormones. And what we're talking, and now a couple other things I'd like to talk about in my talks that I give is elevation. People living in a higher elevation make more red blood cells because there's less oxygen. So every breath they take, there's less oxygen. Their body has to compensate by making more red blood cells. So again, there's different ranges for those type of people. And then there's a few others for ethnicities have different blood. Their blood looks different for a few markers. And then the last one, and the one we're here to talk about, and what Sara and I have been digging into, is around pregnancy trimester. We've at least 50 or more different markers, in blood markers, that change during pregnancy and change throughout the different trimesters. So it's just fascinating if you really want to look at blood work for your clients and look at it properly, you need to first don't look at those conventional ranges, look at a tighter set of optimal functional ranges, and then you really have to apply bio-individuality and use the appropriate reference ranges for your particular client to be the most accurate you can in looking at blood work.
And that's so important to think about it. And that I'm going to confess, it did not occur to me until literally just now while I'm talking to you. So I've had 3 pregnancies and 3 babies, and that is such a small percentage of my life and such a vastly different life cycle. And yet all the blood work that I was doing, this was, of course, before I came into the functional, holistic, integrative world. So it was all conventional. I didn't question anything, but they're comparing me as a pregnant woman to this huge rest of the population. And that really is perhaps not the best way to determine if something's healthy. Can you talk about some of how the pregnancy specific ranges are based on current support for what you guys are doing in terms of how you've put this together?
Yeah. You want to take that one, Sara?
Yeah. So we looked at studies. Basically, there are a few limited places that compile ranges that are specific to pregnancy. And then we also went and looked at specific studies, marker by marker, to look at how things change. So for example, one of my earlier references was the Teats Book of Clinical Chemistry, but it's a massive textbook, and it obviously, I bought it before moving to Italy and lugged it with me, and it is a little bit out of date. So a lot of the studies that we have been looking at have been more recent than what the printed reference is. So for example, looking at liver markers, we dug into literature on alkaline phosphatase during pregnancy and also during lactation, and found out that not only does alkaline phosphatase rise during pregnancy with reference ranges that change from trimester to trimester, but also that it can remain elevated during lactation for up to 8 months after birth. And that is mainly because of the bone turnover. During pregnancy, basically, there are different isomers of alkaline phosphatase, and the bone isomer, and I also believe that the liver isomer is pretty active during pregnancy. But certainly the requirements for calcium during pregnancy and lactation affect alkaline phosphatase levels. So you can't compare what in a pregnant person to non-pregnant alkaline phosphatase ranges.
And having been through that process myself, I know how much a pregnancy can take out of your body. I'm curious, what are the typical blood tests that are normally, first of all, I don't think I ever had any preconception tests, although that probably would have been helpful. But what are some of the blood tests that they typically would run anywhere along that cycle, whether it's if someone does actually go to their doctor and say, hey, I want to get pregnant, let's do some blood work. Or while you're pregnant, I know I certainly gave enough blood. And then afterwards, there were like 2 months worth of blood work, but that was about it.
Yeah. So typically preconception, if somebody's lucky enough to have a doctor or nurse practitioner who will run somewhat comprehensive labs, they will get a comprehensive metabolic panel, complete blood count, and usually TSH and maybe free T4. So basically, the understanding of what's going on with the thyroid is limited, usually just to TSH, and the understanding of what is going on with iron is pretty limited as well. It's really unusual. In fact, I don't think I've ever seen a client who's come to me during preconception whose allopathic care provider ran a full iron panel on them or a full thyroid panel on them. Yeah, and during pregnancy, typically throughout the trimesters, they will look at a complete blood count and comprehensive metabolic panel each trimester.
Mm-hmm. And so how did you, either one of you, the both of you together, how did you at some point decide that, oh, wait a minute, there's a huge difference between what's being done and how the ranges run during this whole conception cycle or pregnancy cycle? What triggered that thought?
Yeah, from my perspective, working in clinical practice over the past decade, mainly what I have wanted to see has come from just what I see clinically. So I want to have more information about a person's thyroid status, because it's one of the first things that I learned is that thyroid function and thyroid autoimmunity can really impact a person's ability to conceive, in addition to the ability to have a healthy full-term pregnancy. And then looking at just even helping people choose a prenatal vitamin. There are many good products out there, top notch, but there's such a vast difference in the amount of nutrients, for example, that I like to test specific nutrients, obviously not only because I want to bio-individualize the person's multi as much as possible, but also because these are nutrients that are really important. For example, take vitamin B6. The top 5 or 6 prenatals that are out there on the market range from 2 milligrams all the way to 50 milligrams of B6.
Oh, wow.
And it's a stunning difference. And why is that? How do you even tell someone which prenatal to take? I see a broad range of differences in what people's B6 levels are. So it gives me such peace of mind to know, oh gosh, this person has a lower end B6. This prenatal is a really good match for them. Obviously, I'm not just looking at B6. I'm giving an example of one of the key nutrients that I am looking at and matching up. Vitamin D is another really important one. Knowing a person's iron status from a complete viewpoint is also really important. So you just really don't get the full information from ferritin. Ferritin is another one of those markers that is run in addition to this complete blood count. So they're mainly looking at hemoglobin and ferritin as markers of iron status. And ferritin can indicate many different things. So you can't assume a person's iron status just from a ferritin level.
So one other question that comes to mind, we're talking about pregnancy markers and women, but are there paternal markers that need to be looked at as well? Should dad be looking at his labs also?
Yeah. There are specific markers that I like to look at in males before conception. And These include nutrient markers that affect sperm health and spermatogenesis and other sperm parameters such as motility. These include vitamin D, zinc, I believe selenium. I like to look at markers of methylation status because it's really important for DNA expression. So B6, B12, folate, homocysteine. And yeah, even in females, there are specific nutrients that can have a huge impact on egg health as well. For example, zinc, again, is a really important nutrient. When the sperm and the egg join, there is this thing called there's a zinc spark that occurs. So you can actually see this under a powerful electron microscope or on YouTube. They have actually filmed the moment when the sperm and the egg join, and there's this flash of light, and that's the zinc that just lights up. It's amazing. So zinc status is incredibly important in both males and females. Retinol is important for both male and female fertility. So really all of the antioxidant nutrients are incredibly important because oxidative stress is one of the things that can most damage both sperm and egg cells.
So it's not about just, hey, I'm getting pregnant and mom goes. It should be both partners going.
Oh, yeah.
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 That's a great point. Thanks for sharing that.
Yeah. Yeah. And there are other less tested markers like iodine and selenium that can really impact. So the sufficient status of iodine and selenium versus insufficient status can make a huge difference in terms of time to conception. And we often forget these nutrients. We don't think about them as being that important, but when you think about it, they're both minerals that affect thyroid function, as well as being selenium in particular is very important for the antioxidant glutathione, and iodine is most prevalent in thyroid and uterus and breast tissue, and in the female and in males it is most prevalent in the thyroid and I think the prostate and maybe the testes. These are important nutrients that sometimes get forgotten, but they shouldn't be.
Yeah, good to know. Thank you.
Yeah.
So actually that brings up a really interesting question, because we have all these different phases, and what I'm hearing is that they each need to be considered within their own lens, if you will, during where they are. So which tests need to be more carefully monitored for their different ranges during like the different trimester, like preconception trimester, post-conception lactation? Which tests need to be most carefully monitored that fluctuate the most during that time?
Yeah. Specifically around the thyroid, like Sara mentioning, people are only ordering TSH, maybe free T4, but for preconception in thyroid, you really want a complete thyroid panel. So TSH, T4 free in total, T3 free in total, the antibodies, TPO and thyroglobulin, reverse T3 uptake, or thyroxine binding globulin, the protein that the thyroid hormones ride along. You want it, or T3 uptake is the opposite of TBG, and you could do either one. It tells you how much room is available, like how much you can uptake, how much that protein can connect to those thyroid hormones. Anyway, so that's the complete thyroid panel, unless I missed one, the thyroid panel that you should run preconception. And then as we were seeing, and this one people may know though, that during pregnancy, so what happens is that human chorionic gonadotropin hormone, HCG, I think I got it right, but that one decreases tremendously just in the
Mhm.
beginning, even in pregnancy. And so that hormone looks similar to TSH. And so that thing attaches to the TSH receptors on the thyroid and starts to stimulate the thyroid to produce more thyroid hormone. And so in pregnancy, especially in that first trimester, TSH drops dramatically because HCG is stimulating that thyroid to make those thyroid hormones, and TBG is increased because trying to pick up more of those thyroid hormones. So like Sara mentioned, though, that's where, or she's had experience where a lot of times clinical indications of you may have thyroid issues, but then high TSH before pregnancy, and then you get into pregnancy and your TSH is normal, and you're thinking, oh, okay, now my issues are gone. But really, that's just the way that works. Maybe Sara can explain a little better, but there's things around thyroid function that really need to be managed throughout.
And that actually has got to be so critical for anyone who comes into pregnancy with some kind of a thyroid issue.
Yeah.
And so it sounds like none of that is being addressed even by functional labs, that they're not specifically diving into that. So is that where you, like, the work that the two of you are doing helps to really support the client because you're looking at a tighter lens, if you will?
Yeah. So there are some allopathic providers who are aware of the pregnancy specific thyroid ranges. Most of those are just looking at TSH and free T4 though. It's very unusual for an allopathic provider to run a full thyroid panel during preconception and during pregnancy. Although when you go in and look at the scientific literature, there is ample discussion of how critical it is to keep an eye on thyroid antibodies, especially as birth approaches and during the postpartum period, because of the prevalence of postpartum thyroiditis and the chances of flaring up a pre-existing Hashimoto's condition, or the onset even of Hashimoto's during the postpartum period, which will typically start for someone with no prior history of Hashimoto's. That can be the first time that thyroid inflammation can manifest, and a subset of these people will develop Hashimoto's as opposed to just having a transient postpartum thyroiditis situation.
And I'm curious, obviously this information is important for anybody who wants to be pregnant, who is pregnant. How is the best way that they can advocate for themselves? Like, how do consumers get access to your software, Marianne? And Sara, how do they perhaps talk with you to learn what they need to know so that they can be supported properly during this time? And I just realized I asked you both a question. So
Yeah.
who goes first?
So I created the software for practitioners, any practitioner, to use with their clients during preconception, throughout pregnancy and postpartum. So any client and Sara is one of my users, and this is how we've connected a few years ago. And when she discovered the software, and like when you were saying in the beginning, Mira, where you'd go to the doctor during pregnancy and get your blood work, and everything looks high or low, like it's all out of whack, and it causes that anxiety. And I hear that from Sara, and other clinicians who work with pregnant women, looking at their blood work, their labs are just all over the place. And the women come in like very anxious. Oh no, what's going on with my labs? They're all crazy. And then they put it into the software, and we use the appropriate reference ranges, and things look normal. And it really alleviates a lot of anxiety around blood work for the women who have so many other things to be worried about during pregnancy. They don't be.
Yeah, sorry, I didn't mean to interrupt. I was going to say, or for someone who has, it sounds like thyroid is hugely impacted, someone who has thyroid issues who goes in and they're told their thyroid is quote unquote normal because they're not looking at enough markers and not going deep enough into what's going on. And they're like, but I feel so exhausted. And they're like, you're pregnant, and nobody's perhaps putting the pieces together.
Yeah. Yeah, absolutely. Yeah.
They need to seek out somebody like Sara or other practitioners in our community that really know and understand how to look at all the appropriate tests.
Sure. And so how did the two of you work together on this project that you have? What part do each of you play in
And
this?
when we start, I've been working on my software since 2018, but pregnancy ranges have been, some markers have had pregnancy ranges for several years around the red blood cell related markers because of hemodilution and how much they change and decrease. But then Sara and I connected, we have a mutual friend and she has been a user for a few years now. And we started talking more about pregnancy ranges and we're like, there's a lot more that change. And then I started digging into it and together, her and I have just uncovered, now I have reference pregnancy trimester specific reference ranges for every 118 markers in the software. So every range has pregnancy trimester specific, every marker does. And thanks to Sara's help with that, now we have software that practitioners can use to really accurately interpret blood work.
Yeah, so we've been basically collaborating on the research side and talking about studies and discrepancies from one study to another and trying to hash things out. I've also been bringing in examples from my clinical practice. A lot of the stuff that I've researched has been because of what I've seen in my clinical practice. So we have a different point of departure, basically, because Marianne has a software that she's working from, whereas I'm working directly with people with specific health concerns and clinical manifestations. It's really fun, actually, to put those two pieces together. And
yeah, and we've been so with all this research that we've done, we're like, we got to get out there and tell everybody about this and share this information, which is why we put together this masterclass that we are going to give in the summer, where we're going to do 6 weeks every Thursday, I think, starting July 13th, 6 weeks live, at least an hour. We were talking
2 hours.
It might be 2 hours, I think.
Yeah.
There's so much information.
So that's for practitioners. That's for clinicians who are focused on either like fertility or reproduction work.
Yeah, those who want to sign up, it is for practitioners, but I don't see any reason why an educated pregnant woman wouldn't want to join and learn more about their markers. Yeah.
And I think one of the things that I really love that I'm hearing about this is how tightly you've focused in on this small niche. Not in my personal opinion, from the work that I've done with clients, and my practice, of course, is mostly gut health, but I find that most women do not think about the preconception period enough, and they don't put enough time and focus and attention. It's, oh yes, let's have a baby. And then if we're fortunate, it happens quickly. If we're not, then we have work with a reproduction specialist. How far before attempting to get pregnant should women start looking at their labs and doing the work to get ready for this whole thing?
Yeah, that's such a great question, Mira. I think it really depends, but at least 3 months. I say 3 to 9 months. I don't want people to feel guilty if they just start working 3 months ahead. It's terrific. You can do so much in those 3 months. If you already know that you're planning to conceive in the next year, it's the perfect time to start thinking about it now.
And one other thing that I really want to point out, and I'm sure you'll both be able to corroborate this, the healthier you are preconception, or even during that conception period, or during the lactation postpartum period, the healthier the infant is.
Oh, yeah.
Mom has more to give and to support nutritionally, because baby basically just takes everything from mom.
Yeah.
Yeah. That's why it is good to test all those different micronutrients in the test that you do, Mira, the micronutrient test. And that would be great for somebody who's thinking about conceiving, is to do one of those tests and work with you on that, because then you have a head start to know which nutrients you're deficient in, so you can start building those up before you're before you're ready to conceive.
In advance. Yeah, absolutely. So ladies, this has been amazing. Like, you have shared so much information. I've learned so much from you. It's really great. And so a couple questions. One, how do people find you? I don't know if you have a conjoined website or if you have two different ones, but please give me the links. I'll put everything below. And then when is your masterclass and how do people sign up for that?
Yeah. We have separate websites. My website is buildnurturerestore.com and Marianne's is labsmarts.com. And our masterclass is starting on July 13th. And I don't, do you have the link handy,
Well, we
Marianne?
can give you the link, Mira.
Yeah, you can just send it to me and I'll put it down
Yeah.
below. But I really feel like this is such an important underserved area, because if we can help create healthier pregnancies, we're creating ultimately healthier babies and moms who are not so depleted by the time they have the baby that it makes them hard to get through those first couple of years.
That's a good point. Don't forget about yourselves after you have that baby.
Yeah, absolutely. Yeah, really, there are two areas there that are key. One of them is epigenetics, which is where the current status of both maternal and paternal health at the time of conception and during the 3 months or so preceding conception affects the way that the offspring's genetic material expresses for life. It's amazing. So the more optimal the parent's physical and mental health and nutrition status is, the better off that child will be for their whole life long. Additionally, yeah, the maternal nutrient status is incredibly important because essentially if the mom is not able to take in and absorb nutrients throughout pregnancy and goes into pregnancy with low nutrient status, the baby is going to basically make heavy withdrawals, so to speak, from maternal bone tissue, and that's just going to cause a lot of issues with maternal health long term.
All really wonderful stuff to think about. I thank you both so much for your time. It was really great to talk with you. Folks, I will put all the links down below, so be sure to check out both LabSmarts and buildnurturerestore.com so that you can work with both of these wonderful ladies. And if you're a consumer listening to this and you want your labs, Marianne, do you have practitioners who run your labs that they can connect with on your website?
Oh yeah, that's a good idea. For myself, if people just want somebody to look at labs, I do that individual work. I'll take a look at your 2 most recent labs, put them in my software, give you my analysis. Or if you need blood work ordered, you're not getting the right test ordered, I can do that as well. But then I want to work on the software. So if there are further things to consider, I would send them to Sara for work.
That sounds great.
Both of you.
Thank you. No, that sounds great. And so I will put all of that information below. Thank you so much for joining me, folks. Thanks for listening in. Don't forget to click that subscribe button and have a healthy, beautiful day.
Bye, everyone.
Bye. Bye.